So again, once again, a warm welcome to you all. Today, we'll be discussing about the journey to the MRCP UK exam. So all of you are able to hear me? Yes, good. So what we're going to do today is we'll have a brief session about 30 minutes to 40 minutes, where we are going to discuss about how to prepare and how to clear this MRCP UK exam in first attempt. Okay, so this will be an interactive session. So I will be happy if all the participants can give their feedback and share their concern or any doubts regarding the exam. So you can stop me at any point or during any of the slides if you have not understood or would like me to repeat the slides. Okay. So first of all, I'll introduce myself. My name is Dr. Pradeep. I work as an assistant professor in the Department of Medicine and also a consultant nephrologist here in India. So I once again welcome you for today's webinar on the basic parts and steps and structures of MRCP UK. I think in the previous webinar, you have gone through the details of the MRCP exam. So I'll be covering few of the points which have been not covered, and I'll be highlighting the important part of this exam. Okay, so let's begin. So this is the overview, what I'm going to discuss, the steps of MRCP exam, the structure, how to prepare, and few of the sample question, and we're going to discuss. So this will be more of an interactive session where we'll be discussing about the MRCP exam, and we'll be sharing our views on the exam and how to prepare for it. So can anybody tell me what's the full form of MRCP?
It should be Membership Royal College of Physicians, Doctor.
Yes, very good, very good, very good. So that's an full form, but what I tell my resident is that yes, yeah. So I tell to all my residents that it's an most resident can pass it. Okay, so it's not a difficult exam. So it's a simple exam. You should know the rules of the game. So once you know all the rules of the game, then you can easily clear this exam. Okay, so remember, it's an easy exam. Don't think about the exam and how to clear it and the difficulties what others are facing. Okay, so what they say is, if they say it's impossible, it is impossible for them, not for you. Okay, so if you focus on the exam, if you're clear about what you need to study, then it will be easy to clear this exam. Okay, so the basic part, remember, it's a diploma degree, and it has got three parts. It has got two theoretical parts, part 1 and part 2, which is written part, and we have the practical examination, which is called PACES. Okay, it's also a part what's called as part 2 clinical. These are the 3 steps. If you clear all the 3 steps, you're going to get a membership, okay, of the Royal College of Physicians. So this is the UK training pro forma or the curriculum. So basically this holds good for UK, not for international medical graduates. So they have a foundation year followed by an internal medicine training for 3 years, where they acquire the MRCP degree, followed by the specialty training, which is for 4 years, and subsequently they can get post CCT credentials. Okay, this is for the international. This is for the UK graduate. International graduate are going to earn MRCP UK, and then they join as a registrar in NHS. So what about part 1? So remember, part 1 is an entry-level exam. The eligibility is that it should have minimum of 12 months of postgraduate experience. So usually in Southeast Asian countries, so once you finish MBBS, after 1 year of finishing the MBBS, probably you can apply for the MRCP part 1 exam. And in part 1 exam, basically you are going to get a few basic questions that involve your first and second year of the MBBS, as well as the few of the clinical questions from the medicine which are relevant in patient care. So the structure of the part 1 exam is an 1-day exam. So you'll finish the exam in 1 day, and it's an 3-hour paper. So you have 3-hour paper in the morning, followed by a gap in the afternoon, and another 3-hour session in the afternoon. Okay, And each 3-hour session consists of 100 questions, which are a best of 5 format, and there are no images. This is the difference between part 2 and part 1. Okay, the part 1 exam does not have any images, whereas part 2 exam, you need to focus on few of the images. And at present, you can take this both as online as well as offline pattern. From 2020 onwards, from the COVID era, where there are the option of online. Otherwise, it was an offline exam. And the MRCP part 1 is conducted in 4 diet. We call it a diet. Basically, each diet means a session. So we have diet 1, diet 2, diet 3, and diet 4. If you're a beginner, you may not understand this diet system, but remember previously we had 3 diets. Now from 2021 onwards, there are 4 diets. Okay, so if you are going to planning to write the exam in the upcoming session, that will be the 3rd session of 2022, and your application period starts from 20 to 27 June. So this is a window period where you need to apply for the part 1 exam, and the exam date is on 24th August. And if you're international graduate, you need to pay about £608, and results are usually 3 to 4 weeks after you are finishing with the exam. Okay, so this is the exam date and fees for those who are beginner who are planning to give the exam. And these are the international centers. So in Southeast Asia, we have India, Pakistan, we have in UAE and Saudi Arabia. So these are the nearby centers which are available in Southeast Asia. How to apply? So you have to go to the MRCP website. You have to log into your MRCP UK web account. You have to create your own account and submit your required qualification, which is the basic degree qualification and your experience of the postgraduate experience, which should be certified by a notary. And ultimately, once you submit the application, you need to pay the fees only it's accepted. So at the time of application, you not pay the fee. Once it's accepted, then only you need to pay the fee for the exam. The format, as we discussed earlier, it's an best of 5 format. So what is the difference between a best of 5 format and other common national entrance test? So best of 5 format means that if you have a question stem and you have the 5 options, one among the 5 will be the answer. It need not be the correct answer. Okay, so among the 5, which is more appropriate to that question stem will be the answer. Okay, so that is called best of 5 format. That means 4 of the options are incorrect and only 1 is correct, and you have to select the best probable answer for that question stem. The advantage of MRCP part 1 is that there are no negative marking. Okay, so some of the national entrances in Southeast Asia have negative marking. So not worry about negative marking. You can safely go ahead with answering all the questions. So it's imperative that you answer all the 100 questions within the given span of 3 hours. Okay, so do not leave any question. Even if you don't know the answer, you have 20% chance of picking a right answer because one of the 5 is correct. So even if you don't have the time, at least last 5 or 10 questions, try to answer as much as possible and give your best shot. Okay, because there are no negative marking in MRCP part 1 exam. And the division for MRCP part 1, as you can see in the slides, we have various specialties starting from cardiology, infectious disease to rheumatology. So I'll not be going to the individual specialties. Remember, what is more important is the number of questions in those subjects. Majority of the subjects, including cardiology, neurology, renal medicine, they have 14 questions each. Okay, they are the major subject. But when it comes to clinical sciences and pharmacology, they have a higher number of questions. Clinical sciences consist of few of the topics from basic science, which will be covered in the next slide. And pharmacology consists of 15 questions. Okay, so what's important to note in this division is that, remember rheumatology. Rheumatology is not a big or a long great chapters in our undergraduate days. Okay, but rheumatology is a big specialty, so it has 14 questions. In your MBBS days, if you're compared rheumatology versus cardiology, obviously cardiology was a major part. But in MRCP part 1, both cardiology and rheumatology has equal weightage. There are 14 questions each. So you cannot neglect any part of the or any specialty for the MRCP part 1. And clinical sciences, you know, it consists of molecular biology, clinical anatomy, physiology, biochemistry, genetics, immunology, and statistics. So these are the part of clinical sciences. So if you go through this, you have like 2, 3, 4, 4, 3, 4, but ultimately they're going to add up about 25. So it's important that you go through these topic as well. I'll tell you how best you can go through this, because most of us have finished are more into clinical practice in clinical medicine. So it may be slightly difficult to go back and read about basic sciences, which you have read long back. Coming to the part 2 exam. So part 2 written is given once you have completed part 1. Again, part 2 builds on the same pattern. We have 3 hours paper, which is 1 session in the morning, 1 session in the afternoon. And mainly the part 2 is different in terms that the questions are slightly lengthier. The clinical scenarios are slightly long, and they focus on diagnostic problem, investigation, plan of management, second line management, complications of treatment, and long-term management and prognosis. So these are the focus of interest or point of interest in when you're going to take part 2 exam. So basically the topic remains the same, but you're going to go in a little more in depth in terms of management. So again, part 2 exam, there are 2 papers, 3-hour session in the morning, 3-hour session in the afternoon. Each session is of 100 multiple choice question. And the difference is that it includes images. Images could be of ECG, images could be chest X-ray, images could be an abdominal X-ray, images could be of any endoscopy, images could be of an echocardiogram. So you can get multiple images, dermatological lesions. Okay, these are the few images which will be coming across. So you need to prepare separately for these image-based questions, because you need to identify the different clinical conditions which are associated with these images. Again, it's examination, offline exam, and it currently is conducted also in an online pattern. So these are the upcoming exam. Again, we have 4 diet for MRCP part 2. The next exam is on 1st of June, and the process of application for these exam remains the same. Again, the international center which offer these exams, again, the same centers which have been for part 1. So you can choose the nearest center to where you are practicing. Application pattern, again, the same. You need to log into the MRCP UK account, enter your personal details, and you need to apply for the you can submit the documents. Your part 1 course is already attached when you apply for part 2, so not worry about the part 1 score, and you need to pay for the exam once the seat is confirmed. And at that, when you apply for part 2, it will going to ask you about college of entry. So you have 3 colleges: Edinburgh, Glasgow, and London. So you can choose any one of them based on your preferences. There's no difference between these membership of these 3 different colleges. And as I mentioned, the edition from part 2 exam is based on ECG, X-ray, CT, MRI scan, and echocardiogram. So we'll be having a separate session for those images. And the pattern is same, best of 5. That means 1 is the appropriate answer, 4 are distractors, or they're inappropriate answers. So you need to select the best of the 5. The topics for the MRCP part 2 is on a different specialty from cardiology. So it's more of clinical based. Here you do not have a basic sciences, but the number of questions of the major specialty are higher. For example, you have 19 questions in cardiology to endocrinology and gastroenterology. So you have a lot of questions on the major subject, and we do not have basic sciences. So it's more of a clinical medicine. So it's slightly easier to answer. The questions are mainly on the management and complication of treatment, and what are the first line, second line management of particular medical conditions. Pass mark for the MRCP part 2 is 454. So your score is going to be somewhere between 200 to 800, which is designed based on a system called as equating system. It is calculated based on number of answers which are correctly answered, and the difficulty of the examination. Okay, so the exact statistical analysis not been displayed by the MRCP website. So it's an equating equation. It matches the difficulty level of the examination to that of the number of questions you have answered correctly. Okay, remember the advantage of MRCP exam is pass or fail. So whether you pass, whether it is 60%, 80%, 90%, it does not matter. Okay, as long as you need to just pass the exam. Okay, that's another beauty of this exam compared to the other national entrances. What the graduate student take in respective countries. Okay, so we not get 80%, 90%. Just pass mark is good enough to get into the next step, which is the PACES or clinical step. So PACES exam, PACES stands for Practical Assessment of Clinical Examination Skills. So it's a skill-based exam. We are going to examine the patient and show you or demonstrate your communication skills and the diagnostic skill. Okay, so it involves a patient or sometimes surrogates, and it's an half-a-day exam which takes place in the hospital, which assess your different core skills. And you have 5 stations. We call it station 1, 2, 3, 4, and 5. So I'll show the carousel, and you have 8 patient encounters. These are the international sites where currently the PACES exam is conducted. So you have in Southeast Asia, you have both India, Pakistan, Sri Lanka, and you also have in Myanmar and Malaysia. And the Middle East country, UAE, and you also have in Saudi Arabia. These are the applications for the Pakistan for the PACES exam. So you can see the different dates, and you have the exam dates displayed, and you have the application window. Remember, again, we have only 3 diet in PACES. 1, 2, 3. We did not have 4 diet, which was there for part 1 and part 2 exam. So this is the current PACES carousel, which is being modified. So in station 1, we have 2 clinical stations, abdominal and respiratory cases. Station 2 about history. Station 3 about cardiovascular and CNS. Station 4 is on communication skills. Station 5 is on brief clinical consultation 1 and 2. So this is a current PACES carousel which is under modification. The skills which are tested are physical examination skill, physical science, clinical communication, differential diagnosis, clinical judgment, managing patient concern, and maintaining patient welfare. These are the 7 skills. You need to pass exam as a whole. You need to get about 130 and above out of 172, and you should also pass in individual skills. So that's a challenge which can be gained, or that the skills can be gained with the appropriate mentorship. So these are the marking skill. Each skill will be marked in each system. So I think we're not going to detail much detail into the PACES encounter. Yeah, so each station we have 2 examiners. Okay, examiner 1 and examiner 2. So for 5 stations you have 10 examiners, and each examiner will grade from 0, 1, 2. 0 is unsatisfactory, 1 is borderline, and 2 is satisfactory. So when you combine the marks of all the 10 examiners, you're going to get the final score. So you need to get a good total. Along with that, you need to pass individual skills. If the total score is low or the individual skill score is low, then you will not be able to clear this exam. So these are the duration for each encounter. So station 1 to station 5. These are the changes which is occurring from this year onwards, PACES 2022. So the communication station has been dropped, and you have the extended brief clinical consultation, which is in the station 5, which is about 20 minutes. Earlier it was for 10 minutes. Okay, these are the few changes I think which you can go through. It is not important at this point in time. These are the steps. So once you clear PACES, you get the membership of the Royal College of Physicians. Then if you're keen to do a specialty certificate examination, you can do even before doing an MRCP. So you can get a certificate in all these specialties after your MD medicine. Okay, so you can get any of these specialty certificate examination. It's just an MCQ exam, which you need to answer about a 3-hour session in the morning, 3-hour session in the afternoon. So if you clear this theory exam or a best of 5 format exam, you're going to get a specialty certificate. Okay, so which will add to your CV. Okay, so remember, you do not need MRCP to get this specialty certificate examination, but do remember that if you want to write MRCP UK, which is one of the internationally reputed degrees, you need to do the part 1, part 2, and PACES. Yeah, so this is the first part of the discussion. So any question, students? Any question from any of you? Any questions so far?
Yes, doctor.
Yes, please. Yes.
Yeah. I want to answer. Thank you for your time.
Yes.
Regarding about this COVID, like this 2 years, is there
Yes.
any issue about the booking system within the MRCP website? Because actually, I just before I plan to book MRCP. I just want to book about PLAB, but there's a lot of issue when we try to booking the PLAB, right? Is there any issue about booking the MRCP, Doctor?
No. Yes, that's a good question. So what has happened is previous 2 years, the PACES, the part 1, part 2 exams have been cancelled, including PACES have been cancelled because of the COVID waves. So a few of the candidates were unable to write the exam. So to accommodate them, they have increased the diet from 3 diet to 4 diet. That means 3 sessions a year to 4 sessions per year. Okay. So at present, whoever applied does not have an issue. They are going to get the slot. They're going to get the slot as usual. Okay. So for last 1 year, because of the increase in the diet or sessions, they are able to manage the pending the exams. Okay. So at present, there are no issue, but still the number of students who are applying for these exams outnumber the number of seats available. Okay. So if you are, so I would recommend you to apply at the earliest once the application window opens. Okay, do not wait for the last day to apply. Okay, you never know what is the scheduled date or whether you're going to get that place of interest. Okay, so always remember, when you apply, you need to give their preferred places. So it'll be 3 or you need to choose 4 places. So you can give the nearest place which is available. But at present, there are no issues of weightage for part 1 and part 2. PACES, there are still some issues. Few of the students are not getting the slot for PACES exam, but for part 1 and part 2, you will get the slots. Hope I have answered your query.
Yeah, thank you, Doctor.
You're welcome. Any other question from any students?
Yes, hello, Doctor.
Yes, please.
Yes, I want to ask you that for the first time registration, we need to submit only our degree with attestations, or need the experience letters also?
No, generally you need to just attestation along with the degree. Okay, the website is going to ask for recommendation. You need to share one of your mentors or one of your teachers' email ID. Okay, so they may send an email to them just to inquire, but otherwise your degree is along with attestation is sufficient.
Okay, if someone is not practicing right now, so is that person is eligible to give exam?
Yes. If you have completed internship and you have been 1 year above the internship, I mean 1 year, you have worked for 1 year in the clinical department or work for 1 year after internship, you are eligible to apply.
So that's mean after 1 year of the internship, we have to show them the 1 year experience.
Yeah, so you not see, they are not going to ask you particular document. Generally, you can show your degree with attestation, and you can give your supervisors somebody's email for cross verification if required.
Okay, thank you, Doctor.
Welcome. Any other questions?
I have a question, sir. Yes. And can I ask a question, Doctor?
Yes, please. Yes, please.
The first one is what is meant by attested degree? Who should be testifying, like from faculty which we have done the program, or?
No. Attestation means from notary. That means any of the advocate or lawyer. Okay, just to make sure that you have the original. Okay. Attestation means that your original copies are verified by a government authorized person. Okay.
Okay, thanks a lot, Doctor. Other thing is, you mentioned about the CCT training in subspecialties. So we don't need to go ahead with MRCP completion to do those things, no? As you said.
No. It depends on you. Super specialty means you are going to do rheumatology, neurology, all this training, which requires you need to go on medicine training before that. Okay. So we are going
so
to,
what are the basic how to apply for that and how to get ready for that? Any idea about it? How to apply for it?
How to apply for basically you're talking about specialty like rheumatology, neurology.
Yes. I don't like diabetes and endocrinology.
Endocrinology. Okay. So once you finish MRCP, you need to go through a registrar post in UK, and then only you have to go through then only you can apply for those posts in the UK. You cannot directly apply for those posts from other countries.
Okay, understood. Thanks a lot, Doctor. Thank you.
Welcome.
I have a question, Doctor, please.
Yes, please.
Okay, I want to ask, will you please guide about the study material, what we are supposed to study, because there is a lot of information over the like internet, and as well, many people tell different things. So if you can specify a few important things that are must to cover, and that may be some notes, or what would you recommend?
Yes. I think that's a part 2 of my talk. This was a part 1. So part 1 was on process of application and a brief course of MRCP UK. Part 2, I'll be covering the rest of the like what to focus and how to study and how to clear these exams. Okay. So I'll be explaining all the things in the coming another 10-15 minutes. Okay.
Thank you.
Doctor, I have another question.
Yes, please.
Yeah. So actually, I have given my part 1 MRCP this diet.
Good.
That was
Okay,
May
good.
18th.
Okay.
Yeah. So actually, we are confused about how the evaluation is. We know there is a system of equating, and
Yes.
like for MRCS example, they have 300 questions and 300 marks, but we have 200 questions and 999 marks.
Yes.
So like we do not get to know how many questions we have answered right, or there's nothing like that, right? So
yes, it's a drawback of this exam. Yes, it's not very transparent. Okay, because you are not going to get the details of that equating system. They just say that it's an equating system, so you do not know what exactly they do in that statistical software. Okay. But generally, you can make out that if you are given what called as a mock exam, okay, if you're earlier given a mock exam, generally about 55 to 60%. If that's your score, 60% score in the mock exam, generally most of the students clear this exam. Okay, so I would recommend, or I would say that if you're going to get around 60% in the mock exam, you are through or you'll clear the exam. Okay, otherwise it may be slightly difficult. Okay, and it depends on the number of people.
Yes. I was getting around 65 to 69%.
Okay.
But I also heard that from my seniors who have given the exam that they were also getting around 65%, 68% like that.
Okay.
But when the results came out, they were really close by. They were like 520, 514. Like that. So it is very confusing because they've written it twice and they are always in 520, 524.
Okay.
So it is very difficult for us to actually know if how many questions are right. We target around 125 questions like that.
Okay.
And
I think there is. I think you should go for the full, like 400. There are 100 questions in the morning, 100 in the afternoon. So you should get at least. I think if you're because the difficulty level is increasing as the year is passing. Okay, because you cannot give the same questions. Okay, so whatever question banks are available are of like couple of years back. Okay. So you may score a good marks in those tests, okay? But as the years pass by, we're going to get more competitive questions, okay? The exam will be much harder than what you see in the past questions, okay? Because the number of questions are limited and these questions are set by experts, okay? And you know that how it's very difficult to set these exam questions, okay? So I set few of the MRCP exam questions. It's difficult to set this question because you need to be correct and it should be a current UK guideline and it should not be a repeat question. Most of the clinically interesting patient-centered topics are covered, okay? So it's very difficult to set the new question and it's a new topic. Like it may be, so most of the new questions are on new drugs or COVID or some of the new diseases, okay?
Well, that's what I felt when the first paper when we wrote this time. I think most of us felt that the paper was a little vague.
Yes.
Like we could answer the questions and the answers.
Yes.
They were a little vague. So we are very concerned about that only. Like the passing criteria itself is set so high only because for MRCP. So that's why I wanted to know about the questions. Like if there's any target number of questions that we have to know that, okay, if we at least answer these many questions, we are sure that, okay,
yes. No, I think your target should be slightly higher. In current practice, maybe about 70 to 80%. Okay, that would make sure that you will clear the exam. Okay, and you will get about 20% of new questions. Okay, it depends on if you don't answer those 20% of new questions, your score is going to decrease drastically. Okay, because when you are answering a mock exam, there are no questions in it. Okay, all are previous old questions. Okay. So if you're getting around 60% in the mock exam or 67%, it's like you are it depends on how much of the new question you're going to answer in the real exam. Okay, so real exam has about 20% of new question, and if you don't answer any one of them, your 67% will come down to 57%. Okay, so that's why I think you are getting stuck. Okay, I'll tell you how to can improve your scoring pattern. Okay, we're going to discuss that in the part 2. Okay.
All right. Thank you so much.
Welcome.
Hello, doctor.
Yes, please.
I have a question, please.
Yes.
Actually, I'm wondering if it is possible to book the MRCP1 exam for someone who doesn't have any work experience apart from 1 year of internship.
Yeah, if you cross 1 year and currently not working, is it?
Yeah.
Yeah. So what you can still apply. You can give your MBBS whatever degree certificate and internship experience. Okay, but if you have you not worked in any hospital after the internship?
No, not at all. Just with the 1 year of internship, 12 months.
Okay.
In different wards, different specialties, 4 specialties. Okay. Apart from that, I didn't have the opportunity to work for personal circumstances.
Okay.
And I'm considering the MRCP route now. So I'm wondering what do you think about it?
Yeah, I think it's generally what, as per the rules, say they require 1 year of postgraduate experience, 12 months of postgraduate experience, which you can show in any of the hospital if you're attached. Okay. Otherwise, it may be difficult to get the slot.
Okay. So
what you can start preparing now. You can. Are you working now?
Yeah.
Yeah. So I think you start preparing now. By the time you get 1 year experience, probably you can apply.
Okay. Because I have certificate of the 4 wards where I did my internship. So I have proof for 12 months non-stop. Without any.
Okay.
Yeah. Apart from that, I don't have. So.
Okay. No. Generally, it is not advised to apply for 12 months. Okay. But if you have, I'm not sure whether they're going to accept it or not. Okay. Again, it's a subjective. Okay. So if you can't, you can try, because you need to pay the fees only when the seat is confirmed. Okay.
Okay.
You're not worry about the paying money and losing the money. So if you think whether they'll accept it, I'm not sure. So you can try applying for the part 1 in that scenario.
Okay. Thank you so much for your help.
Yeah. Welcome. Yes. Any other questions?
Excuse me, doctor. May I ask you one question, please?
Yes, sure.
On the first question, you mentioned that the MRCP applicants outnumbered the quota for every application.
Yes.
Do you by any chance know, like, for which center or which international center are you usually overloaded with this kind of situation?
Yeah. No. I think it's very difficult to get that information. They do not share the information. But what I've found is, unless the student can, for part 1 and part 2, unless few of the students cancel the exam. Okay, what happens is, for example, the next part 1 exam is after 3 months. I think that I can do it and I apply for this exam. Okay, and just before the exam, I'll cancel because I feel that I am not prepared well. Okay, in such a scenario, you will get the slot. Okay, because one or other students have cancelled. Okay, but we do not know for sure that which center are overburdened or which centers you will get the slot. I would recommend you to, because there are 4 options. Okay, there are 4 options when you apply for the MRCP website. So you select the nearest options and you go for it. Generally, most of the students are going to get this part 1 and part 2 application. Okay.
All right, doctor. Thank you.
Okay, welcome. Any other questions?
I have one question, doctor.
Yes, please.
Please suggest the good books for MRCP part 1 and part 2.
Yes. That's what I'm going to talk in next session.
Okay. Thank you.
Welcome. Any other questions?
Hello, sir.
Yes.
Can FMG doctors apply for this exam, sir?
If you have 12 months of experience after MBBS,
I
you
have
can
not
apply.
passed. Actually, sir, I have not passed MCA exam, but I have 3 years of experience. Somehow I did.
Yeah, but you need to get the undergraduate MBBS cleared. Otherwise, you cannot apply.
Yeah, I have already cleared.
You cleared MBBS exam?
Yes, yes, I am FMG doctor, but not completed here MCA exam in India.
Yeah, so MCA's exam is okay. That's to practice in India, isn't it?
Yes, but
Yes.
we will get internship after passing MCA exam. But I don't
then
have
you cannot apply. Then you cannot apply. You need to have clear internship. Then only you can apply.
Okay.
Okay. So you can work on this MRCP exam. Meanwhile, you don't.
Actually, I have asked online from MRCPI page. So
okay.
I have sent my documents. They told me that you are eligible.
Okay. So that's what happens. So few of the time it's quite subjective. If MRCP UK website itself has given you the provision, then I think you can please go ahead with the application.
Okay, sir,
because I'm not sure about the FMG, but the eligibility criteria, it's quite strict, saying that you should be clear MBBS with internship and 1 year of post graduation after that. So if you have written a query and they have accepted it, I think then you can apply for the MRCP exam. Okay.
Yeah, sir, but I am still in confusion. I don't know.
No, you apply. Please go ahead with the application.
I thoroughly asked them and sent my documents. I told them I don't have internship. I have FMG doctor in India.
Okay.
They 2 times replied me that you are eligible.
Okay. Then you go ahead with the application. I would recommend, because the payment is at the end. Okay, don't worry. And your account is not going to get blocked or something. It's your MRCP account will stay there. So you just go and open an my MRCP account, attach all the documents, select a center and apply for it. Okay.
Okay, sir.
But make sure you're prepared. Okay, because you're going to get the immediate next slot.
Okay. If they have to reject me, okay, sir. If they have to reject me, they will reject me before my payment or after payment?
Yes. You'll get a mail immediately that before payment. Payment is only once everything is confirmed. Okay.
Thank you so much, sir.
Welcome. Any other questions?
Yes, please, doctor. I have another question, if possible.
Yes, please.
I'm wondering if MRCP preparation would be helpful for the PLAB exam, or is it a completely different scope?
No, MRCP is slightly higher in terms of quality of questions. So PLAB is a slightly superficial exam, which is slightly easier. Okay. So you take any one of the route. So MRCP is mainly you're going for physician streamline. Okay. From PLAB, you can enter. You can do any of the other specialty as well. Okay.
Okay.
So MRCP has slightly harder question in terms of depth of questions. Okay, depth of topics. PLAB is slightly superficial, and you get a question from all specialties.
Okay, I see. Thank you so much.
Welcome. Any other questions? Okay. So if there are no questions, we'll move on to the part 2. That's to our main agenda for today is to focus on the part 1 exam. Okay, as most of you are preparing or are focusing on the part 1 exam. Okay. So we have covered this part 1 exam. It's 2 sessions, 100 questions each in the morning, 100 questions in the afternoon. It does not have any images. It's either online or offline. And these are the topics which we have covered in detail. So one of the point which I want to stress upon here is that the clinical sciences consist about, we have here about 7 topics. Okay. And most of you are post your undergraduate degree or maybe working in different hospital or any of the medical specialties. It may be slightly difficult to go through these clinical sciences. Okay, that's why I recommend to go through the past question which have been asked in these specialties, except for statistics and epidemiology. Okay, the statistics and epidemiology, you need to go through the entire topic from different books which are available, because there are 5 questions, but the rest of the things you go through the past questions because it is impossible to cover clinical anatomy in like 4 to 6 months, and you cannot read anatomy for 6 months and get only 3 questions. It's impossible. So I would recommend, if you're going to focus on this clinical sciences, please go through the past question, previously asked question, and from the question bank. That is more than enough. And I would recommend you to revise this just before the exam, because these are highly volatile subjects. You may not be able to remember for long. Okay, so you need to read it before exam and revise just a day or 48 hours before the exam, so that you can remember. Okay, best would be to make a notes out of it. Okay, but statistics and epidemiology you need to read when you have a lot of time, because you need to apply the different statistical tests for different situations. Okay, so you need to go through them slightly in detail, but rest of the topics don't need to go through in textbook. Just go through a few previous questions. That is more than enough. Okay. So this is about the clinical sciences. Now come to the resources. I think a couple of you have already asked what are the resources available. Okay. So first thing, textbooks. So we have read through different textbooks like Harrison's. We have the Davidson textbook, Kumar and Clark. So a lot of textbooks are available in medicine. I would not recommend you to go to the textbooks. Textbook should be kept for your references only. Okay, so we do not have that much time to go through all the medicine in the textbooks. Okay, textbooks are to be kept for references only, and you need to go through only the question bank and the notes. Okay, when you come to the notes, you have different notes. There are multiple resources available in the internet. Okay, we have textbook by Philip Calra. We also have textbook Step Up MRCP. We have notes and notes. So we have a lot of different resources are available. Printed notes are available. You can select any one of them and you can stick to it. Okay. So what I would recommend is prepare your own notes if you have time, if you have a habit of making notes, where you can write the difficult topics and where you can revise them. So what I used to do is I used to carry a pocket notes where I used to write difficult topics, especially pharmacology, immunology topics, okay, which are quite volatile. You need to revise them. For example, class 1 antiarrhythmic, class 2 antiarrhythmics. Okay, it's difficult to remember which group of drugs belong to which category. Okay, so we can make a small pocket notes and keep that. And whenever working in the hospital or the clinic, okay, you can just revise them and go through them on a daily basis, or at least on a couple of occasions in a week. Okay, so revision is the key to remember the difficult things. Okay, so notes is important. I would leave you to make a personalized notes, which are quite important. And online videos, there are various online videos are available. Online question banks. So we have past test, past medicine, BMJ. These are the various online question banks which are available. So you can go through any one of them, but do remember the number of questions. For example, past test has a lot of questions, 5,000, 6,000 questions. Are you able to complete that before the exam? And it's not just you need to complete once, you need to complete it 2 or 3 times and revise them, because unless you do that, it'll be difficult to get the good score in the exam. What happens with most of the student is that they take subscription of the past test. There are 6,000 questions in it. They'll be able to complete only 3,000. So you're left with another 3,000. The exam is the dates come nearby, and they try to revise only those 3,000. Okay. Ultimately, we end up not completing those question bank. Okay. So do think about the number of questions available in particular platform, and and how much time you have to prepare, how much time you have to revise. Okay, past questions are available in all the platforms, and we have various books which are available in the internet as well, which gives you the different past questions. Okay, again, these are subjective and memory based. There may be slight difference in the questions. Remember, the number of questions, the type of question are not one and the same for each and every candidate. There are slightly differences between the questions. Okay. So when coming to the courses, you can attend any of the crash course or the lecture series, which will be helpful, where the people who are taken, the mentors will be discussing about the various options, how to focus on a particular topic, and what are the important points you should not miss. Okay, so the courses are quite helpful. So you can join any of the courses as well. So depending on your preferences, what I would recommend is to stick to one book, make a notes of your own if possible, and go through online or any question banks. Okay, past question bank, anything. Okay, and for those of you who do not have much time, courses are helpful because they're going to, the mentors will be telling what is more important and how you can answer these questions. Okay, so this is in short about resources. I think a couple of you asked about these resources. I hope you have answered. I hope I have answered your questions here. A few facts about MRCP or few questions in MRCP part 1 preparation where the students usually ask. So what's a good part 1 score? So a pass mark is 540. Definitely you should give above 540. And the second question usually student asks is what's the time required for the preparation for MRCP. So it depends on what stage of the undergraduate or post-graduation you are in. If you just graduated MBBS and your internship, it requires at least about 8 to 9 months, 8 to 10 months if you are preparing for that, provided you can give up to 3 hours per day. If you are working, then it requires at least 6 months preparation. With 6 months preparation, if you are sitting freely at home, not doing any work, then about 4 months of preparation is more than enough, provided you give more than 4 hours per day. Okay, so it depends on how much time you can dedicate per day. Okay, so what I find, if you're the students, they apply with a good enthusiasm that they are going to write the exam in 3 months and 4 months. Ultimately, once the exam comes nearby, the preparation is not so good. They're also working. They need to take again leave about 1 month or 15 days from their work, and then trying to focus on the exam and ultimately losing the part 1. Okay, so planning is important. Okay, if you think that you cannot prepare in 3 months, due to the next diet or due to the next session. Okay, do not think practically. If you're most of the students are working. Okay, nobody's sitting at home and preparing for MRCP exam. Most of the students are working, so they have work from 9 to 5, 9 to 6, and then they need to dedicate 2 to 3 hours per day minimum. Okay, so you take the exam, time your exam very well. Timing is more important. Okay, if you're going to give exam in 3 months, you should be able to dedicate at least 4 hours per day for preparing MRCP. Otherwise, it may be difficult. Okay, these exams are expensive. It's not easy that once you clear, if you do not clear the exam, you need to again pay the fee, again prepare well. Okay, and you, as a morale, if you don't clear the part 1 in first attempt, your morale goes down. Okay, so a few of them usually may not continue attempting MRCP as well. Okay, so it's quite important that there is a first step, MRCP part 1. You give your good preparation, plan it well, and give it your best shot. Okay, that's how you can clear the part 1 in first attempt. Again, the pass percentage is difficult for UK trainee and international trainee. So UK trainees are slightly better into clearing the exam because they understand these scenarios and these regulations. Okay. Now, when you talking about the clinical scenarios, it's a clinical scenario. How do you manage in the UK? Okay, so nice guidelines are important. Okay, we as an international graduate, medical graduate, may not be. Our guidelines may be slightly different. We may follow American guidelines or national guidelines, which is slightly different. So, okay, so, and we may not give that much importance to probably driving, okay, or to giving any insulin. What are the preferences required to give insulin? Okay, these differ from UK to the rest of the world. Okay, so you need to focus on that as well. Okay. So this is the graph which is showing the number of people who pass. Okay, these are the group of people who pass in first attempt. Okay, what's more important is those who, even if you give second attempt, the number of people who are failing also significantly higher. Okay, a number of people, once you do not give a first attempt, you do not do well in the first attempt, then the pass percent in second attempts also becomes slightly difficult. Okay, and there are few group of people who will never take MRCP once you clear in the first attempts. Okay, so ideally, as much as possible, plan your first attempt well. Okay, even if you have not cleared in the first attempt, I'll tell you how you can better it in the second attempt. Okay, and what are the steps for clearing in the first attempt? So you should know the rules of the game. What mean rules of the game? So you will be good in any game if you are good, if you know the rules. For example, you know Usain Bolt, who is a good athlete, who runner, you ask him to play cricket, then he may not be good in the cricket. Okay, you need to train yourself for the MRCP exam. Okay, so what's important? For example, I'll give an example. A chronic diarrhea patient and headache in MRCP exam is multiple endocrine neoplasia. As a clinician with the last 12 years of experience, I have seen only one patient of men's syndrome. Okay, in clinical practice, it's quite rare and very, very rare. Okay, but in MRCP exam, it's quite important. Okay. Another question: somebody comes with bronchospasm and flushing. Okay, it's carcinoid syndrome for MRCP exam. hardly I've seen 1 or 2 patients in carcinoid syndrome in clinical practice. Okay, it's quite rare as a in the bedside or in hospital practice, but it's quite common in the MRCP exam. Okay, so if you know these stuffs which you're going to come by practice and studying, okay, you'll know how to answer these questions. Okay, so they don't want to miss serious lethal condition like carcinoid syndrome or a MEN syndrome, which are treatable. Okay, that's a whole point or whole idea about presenting these questions or clinical scenario in the exam. Okay, these are quite rare conditions, but you should not miss them because they're treatable. Okay, that's the whole idea behind asking these rare questions in the MRCP exam. Okay, the first thing is always you plan your study. So do not apply in a hurry. Make sure that you prepared well before your application. Okay, and always when you read the question, you need to read question stem quite carefully because there are some keywords in it. Okay, for example, are they asking the management? Are they asking the diagnosis? Are they asking the specific treatment? Or sometimes you'll have a very long question and ultimately they're going to ask some basic science question. Okay, for example, they're going to ask about a lot of everything about atrial septal defect. Ultimately, they're going to ask how does septum primum, septum secundum is developed from which part of the embryonal structure. Okay, so you need to read the questions quite carefully, identify the keyword. I will also recommend, if the question is quite lengthy, go through the options. You'll know what they're going to ask. Okay, if you have a long question on respiratory system or a cough, fever, wheeze, and ultimately you go to the answer options are like TB, bronchiectasis, you know they're going to ask about diagnosis. Okay, or you have another long question on respiratory system. At the end, they're asking about salbutamol, or the other options. They're going to give the, for example, the adrenaline. They're going to give the other bronchodilators. Okay, you know what they're going to ask. Are they asking the treatment? Are they asking the diagnosis? Okay, or they're asking the prognosis. Okay, so sometimes the questions are quite lengthy. Read the options first, which will give the clue that what you need to focus on the question step. Okay, and always look for frequently recurring topics. Okay, for example, in cardiology, you're going to always get a question on atrial fibrillation. Okay, you're always going to get an atrial fibrillation, MI, and the angina, heart failure. Okay, these are important topics from cardiology point of view. So you're always going to get a question on that. Endocrine, you're always going to get questions on hypothyroidism, hyperthyroidism, diabetes. It is a topic which cannot be skipped. Okay, so always you need to get full answer. You need to get full score on these topics. Okay, so always look for frequently recurring topics. Okay, and always focus on the clinically relevant and related patient safety. That means the whole idea of setting the question is they want to make a doctor who is safe. Okay, a doctor who is confident, who can manage the patient in the UK setting, who knows the rules of the UK, who knows these guidelines, and you can be safe doctor. That means they do not want to miss some lethal, or even though lethal cases, even though it's quite rare. Okay, that's the whole idea of preparing for the MRCP exam. Okay, so continue your study. You have to revise them. Without revision, you need to keep at least 1 month time for revision. Otherwise, it's not possible. You'll not remember the whole what we have learned. Okay, and always do the mock exam under time condition. So you need to give at least about 2 or 3 mock exam before you give the part 1 exam. Time it well. Okay, so that you can answer all the question. Okay, so you need to able to answer 100 question in 2.5 hours. That's what the target should be when you give mock exam. Okay, because in the exam under the stress, you are going to take it to 3 hours. Okay, so try to answer 100 question in 2 hours 30 minutes or 2 hours 40 minutes, so that you have extra 20 minutes in the real exam. Okay, that will be useful. Okay, and a few of the topics are difficult to remember or memorize. Okay, so you should understand the concept. So understand the concept will give you you'll remember for a longer time. Okay, so suppose you don't understand why a class 1 antiarrhythmic is quinidine. Okay, it's not just memorizing them. Okay, so you need to go through the concept. How does class 1A antiarrhythmic different from class 2? Okay, so there are concepts on it, how to remember, and what exactly is the why they are different classes. Okay, so so that will also help. Okay, and ask the people who have passed MRCP for advice. Okay, because they have gone through that experience, so they'll be able to give. Now again, it's individualized experience. Do not stick to the one person's advice, because the different if you ask different students, they'll give different, saying the different views. That book is good, this book is good. So what I generally tell my student is that just go through 3 or 4 books, go through few pages, 10-15 pages. If you're comfortable with any one of them, stick to one. Okay, do not read all the books, just stick to one of the books. Okay, and you need to study them at least 2 or 3 times and revise them. Then only you will be able to get a good score. Okay, and answering the questions are important rather than finishing the textbook or finishing those notes. Okay, so try to answer as many questions as possible, which will help you to gain confidence. Okay, so always believe in yourself, and I think that anything is possible if you believe in yourself. If you think that you can clear in first attempt, you will be able to do it. Okay, provided you have planned well and you have studied and revised. Okay, so this was the part what we have discussed. I've got few questions. Okay, only 3 questions. Okay, so I'll go through a few questions of MRCP part 1. I tell you how to. So this is one of the simple question. 70-year-old woman complaining of pain at the base of the right thumb. There is tenderness and swelling of the right first carpometacarpal joint. What is the likely diagnosis? Anybody has any idea what is it? So thumb in, yes, anybody?
Tenosynovitis?
Unfortunately, that is not the answer. Answer is osteoarthritis. Okay, basically there is an involvement of the carpometacarpal joint. Okay, that's one which is usually involved. Okay, so it's tenosynovitis, a tendon problem. Okay, here they are asked specifically about tenderness at the joint. Okay, when you have tenderness in the joint, it's usually arthritis. Okay, arthritis. So the differential diagnosis is osteoarthritis, psoriatic arthritis. These are the 2 differential diagnoses. But base of the thumb is common in osteoarthritis. Okay. So this is another question, which is about 82-year-old woman who is presenting with confusion. Of note, in her past history, there's a Raynaud phenomena. So some autoimmune phenomena is going on. HB is 9.7, white cell count is 3,600, platelet is 1 lakh, total protein is 120, immunoglobulin IgA is normal, IgG is again slightly higher, IgM is very high. Okay, so this patient has elderly patient is coming with a very high IgM level. Okay, any idea what it could be? A very high IgM level in a patient, elderly patient.
Hyperviscosity syndrome.
Yes, very good. So it's an hyperviscosity syndrome because of the Waldenstrom's macroglobulinemia. Okay, so one of the variant of plasma cell dyscrasia. Okay, so this is another question. So here, see, this question is quite lengthy. Okay, so I would, if I'm a student, I'm giving the exam, I'll go to the answers first. Okay, so Pott's disease, osteoporosis, multiple myeloma, ankylosing spondylitis, syringomyelia. What they want me to diagnose. Okay, so then you read the question. When you read the question, you have to focus on the diagnosis. Okay, your mind should focus on the diagnosis, not on any other aspect. Okay, now back to the question. We know they're going to ask about diagnosis. Now read the questions. 35-year-old woman recently arrived in UK from Ghana. Okay, so anybody who's coming from a developing country to UK, think about infectious disease. Okay, she complains of neck pain, pins and needles affecting the right arm, associated with a weak grip. Okay, so she has neurological issue affecting the right upper limb. Examination reveals tenderness over the cervical spine. X-ray of the cervical spine shows narrowing of C3, C4, C4, C5 with the collapse of C4 vertebra. Investigation shows hemoglobin of 9.5, WBC count is normal, platelet is slightly higher, ESR is very high, CRP is very high, calcium again normal, albumin is normal, alkaline phosphatase is slightly higher, phosphatase is on lower side. Okay, so what is the likely diagnosis? Anybody wants to take a guess in this? Yeah, it's a POTS disease, TB spine. Okay, it's a POTS disease. So the clue is in the demography. Okay, somebody is coming from the Southeast Asia, somebody is coming from Russia, or somebody is coming from the Africa. Okay, think about TB. Okay, so there are some clues to the geographical location. Okay, so we're going to discuss that in all the course. For example, somebody is coming from diarrhea with Russia. Think about you're going to think about giardiasis. Okay, it's quite common there. Okay. So a few of the clues from geography are important, which we'll be discussing in the infectious disease lecture. So this is a POTS disease, patient had cervical. This is a child. This does not fit into that image. Is taken from the internet. It's not related to this patient, but it's just depicting the POTS disease. Okay. So this is how we'll be able to answer the questions. Okay. And why you should do MRCP UK? If it's is it difficult, then why should struggle for these for 2 years, 3 years? Okay. Remember, it's an recognition which is quite it's worldwide, and it's considered a symbol of excellence. It's a gold standard in medical qualification. In addition, it improves the medical knowledge and skill. Okay, even if you are a practicing doctor and you're happy with your practice and don't want to go abroad, okay, just doing MRCP, you can upgrade your skill. Okay, theoretically as well as practically. When you take the PACES exam, you will be able to understand better, because by practicing for PACES, you'll be able to pick up the few of the bedside diagnosis just by looking at the physical skill, and power of observation will increase tremendously when you prepare for PACES exam. Okay, and always you'll be able to get a higher pay as well as the higher position in academic or your medical profession. So it's always good. So you maybe need to struggle for a couple of years, but it's worth the struggle, and it's going to have a tremendous implications on your personal and your professional life as well. Okay. So just to summarize, remember, MRCP is a diploma degree. There are 3 steps in it. You have to always plan and study. Always give mock exam before you give the real exam. Stay focused, and you can clear the MRCP. I think that's all I had to share with you. So if you have any questions or anything, you can always share with me. If you have clarification or you want to add any comments to the presentation, you are always welcome. Any questions from anyone?
Doctor?
Yes.
Are we given the exact reference ranges in the real situations, in the real test?
Yes. Yes, if it's a rare value, they're going to give the reference. For example, going to FT4, free T4, free T3, they'll give the in the bracket. Okay.
Okay. Is it the form is like just a paper, or they provided with the
in the question stem, in the question stem itself?
Okay.
Or in the question stem itself, they're going to give that range. Okay.
Okay. Otherwise, we have to memorize the normal value. Yeah.
Yes, so you're not expected, so you'll be expected to know hemoglobin, normal total count, normal platelet, okay? But you may not be expected to remember the normal MCHC, RDW, okay? So they will give a range.
Okay, I'm sorry, doctor, one more questions.
Yes,
you have said that for the part 1, it should be like 200 questions for 3 hours, and one the morning, and the last one will be on the afternoon. So the first test in the morning should be 100 questions for 1 hour and 30 minutes.
No. It's 100 questions in the morning, 100 questions in the afternoon. Total 200 questions. Okay. So 100 questions for 3 hours, 100 questions for again 3 hours in the afternoon session.
All 3 hours and 3 hours.
Yes. 3 plus 3, 6 hours. And 200 questions. Okay, it may appear quite easy, but remember, those question stems are quite lengthier, and you take a lot of time to read them and try to understand and analyze them.
Okay, all right. Big thanks for that.
Yeah, welcome. Any other questions?
Yes, doctor. You mentioned about making our own notes. So what is from where we should be starting our notes to prepare with? You are telling you just told that not to like memorize the whole book like Kumar and Clark, not to read from top to bottom, but from where to start writing up our notes on our own, from what to like we have to refer. And the other part is in some of the journeys I have gone through in the internet, they say like Maghrabi notes like that, but it is like they have written the exam in 2019 or something like that. So they might be like outdated. So we are not sure on to like which to stick on it. So it's very confusing. Can you please particularly tell to refer something like 1 or 2, 3 options so that we can stick to one? So if possible, just to send us a mail or a WhatsApp. So the names of the books and the past medicine or past test, what is the best to like to tell your recommendations, please, so that it will be giving us a clue. Thank you.
Okay, welcome. So it's a good question. So, so most of the students are confused from where to start. Okay, so if you look at the textbooks, there are 3 textbooks that are available. One is called Philip Kalra. I think I'm not sure of the name. The author is Philip Kalra. Second is Step Up. Third is Notes and Notes. These are 3 famous authored books which are available. Okay, these are textbooks or notes which are printed, so you need to read them. You can either read them hard copy or soft copy. Both are available. And other thing is question banks. Question banks, we have 3 important ones: past test, past medicine, and the past medicine, past test, and BMJ. Okay, these are 3 important things which are available. Okay, so what generally is, you can go through one of these books, either Step Up or the Notes and Notes or Philip Kalra, whichever you like. You can go through, keep as a reference book, or you can go through them whenever you are free. Okay, stick to one book and go to the platform, the question bank platform, okay, like past test or past medicine and BMJ. So what you'll find is, when you're trying to answer the question, okay, there are some explanation in the website. Okay, so you go through those explanations, write it, make a notes of the explanation. Okay, so if you're answering a question from the past test, when you answer those questions, the explanation will be there. Okay, from that you can make a notes on particular topic. Okay, what will be ideal is you take one of these 3 textbooks, either Philip Kalra or Notes and Notes or Step Up, whatever it is. Go to finish that chapter, then go to the past test, finish all the questions, and when you're going to get a new point or any topic, you make a notes of your own. Okay, after going through one of the hard textbooks and then the past test. Okay, so that's one way of starting your the MRCP part 1 journey. Okay, our second part is, don't read any of the textbook, like don't read any of these 3 mentioned books. Just stick to past test or past medicine. Just try answering those questions. Okay, so when you answer question, most of the answer you may not be able to answer correctly, so there will be explanation in it. Just write the explanation part in your notes, what you need to remember. Okay, and if you have diet, just go to the nice guideline link, will be there, when provided there, nice guideline or textbook like Kumar and Clark or Davidson, whatever is there. Okay, so this is another way of making the notes. Okay, so go to the past test or past medicine website and making a notes. You should, if you, those explanation, you can write it down on your own notes. Okay, for example, I'm going to talk about rheumatology, so make 1 page note for rheumatoid arthritis, 1 more page for gout, 1 more page for ankylosing spondylitis. Okay, write down the important points which are there in the explanation. Okay, that's how you can make a note from past test or past medicine. Or you can also go through these books if you have time. Okay, and these personalized notes you should be able to revise at just before exam. Okay, because that gives the clues, and that also gives have all the old questions in it. Okay, because you have written down from a previous questions. Okay, so it has got all the points in it, and it's in your own handwriting, so you'll be able to revise it much more faster than reading from past test or past medicine again, or from any of the books. Okay, so this is one of the ways how you can make a notes. When you make a notes, one is the big notes. One more is pocket. If you're working in the hospital, if difficult to get, if you get like 10-15 minutes in between the breaks, okay, so it's easy to carry a pocket notes which you can copy the most difficult part, or some of the volatile subjects which are maybe difficult to remember the things, maybe a side effect of the drug, maybe a drug of choice, maybe a mechanism of action. Okay, so something like that you can make a separate pocket notes in it, and you can revise them, because those difficult topics need to revise 3-4 times or sometimes 5 times to remember the concepts. Okay, so this is how you can make a notes of your own. Okay, I hope I have answered or cleared your question. Any other?
It was an excellent explanation, sir. Thanks a lot.
Welcome.
Sir, I just had a question.
Yes, please.
Actually, on the specialty center, specialty certificate examination ka website, I just read it that it is no longer necessary for applicants for the specialty, the SCE exam, to have been passed the MRCP UK exam. But what does that mean, sir?
That means you can apply immediately after your MD.
Okay.
Okay, you can apply. You not have a MRCP exam. Okay. In my case, I attempted first SE. I'm a nephrologist, so I gave nephrology SE first. Then I did MRCP medicine.
Okay.
Okay. So remember, SE is like any certificate. Okay, it's a certificate. Just like you can do some course in Coursera, no? We have Coursera platforms. Okay, just additional certificate. Okay, it does not carry a great value. This SE certificate, because this certificate you're going to get if you by writing an MCQ exam. There's no practical skill demonstration. Okay, whereas MRCP has a demonstration of skills. Okay, like communication skill, practical skills. Okay, so that's why it does not hold much value. But if you're going to an interview where both the candidate have the same CV, and if you have additional SEE, which the other person does not have, then it may add a value. Otherwise, it does not have a great value. Okay, SEE exams.
Okay, sir. Thank you so much.
Okay, welcome.
Excuse me, doctor. I have a question, please.
Yes, please.
Could you please suggest us a course to prepare the MRCP Part 1?
Yeah, I think from Med Exam Expert, we are going to start a course here itself. So you can stay updated. We'll be starting a course soon. Okay.
What is the link for the course, or I'm not sure because I've just found your webinar randomly on Facebook page.
Okay. Okay. I think we'll be sharing the course details as soon as possible. Okay. So in the course, how we are planning is like we'll be having one session per week, 1 to 2 sessions per week. Each session will be for 2 to 3 hours. Okay, where we'll be covering the important topics, and at the end we'll be covering all the important questions. Okay, we'll go to the question. Just going through a topic is not enough to get the confidence to clear the exam. Okay, so we'll be discussing all the topics which are important topics, and based on what questions have been asked in the past. And at the final phase, we'll be discussing the questions as well, how to read the question, how to answer those questions. Okay.
Okay. And what's the name of the course, please?
I think I'll share. I think we'll be sharing at the end. I think we have coordinator in the online here, so she'll be sharing the link and the details. Okay.
At the end of this webinar, yeah.
Yes, I think you just keep in touch with Med Exam Expert. Our course, she'll be. I think they will be able to take. I think you have the WhatsApp and the details available. Website details are available. So we will be beginning the course quite as soon as possible. Okay.
Hello there, sir.
Yes, yes.
Sir, I wanted to ask, I just missed out on this webinar session, so I wanted to ask if we'll be provided with the screen recording of this session.
I think so. I think it's available. Okay, it will be available, and we'll be sharing in our website and the Facebook page.
All right, thanks.
Okay. Any questions? Do you have any particular question in mind?
Sorry, doctor. Yeah, one more question, please.
Yes, please. Yes, please.
Yeah, I'm sorry. Based on your experience, doctor, which of the bank questions give the most representative at the actual test? Is it past tests or past medicine or BMG? Based on your experience.
Part one is past test. Part one is past test. Okay. But what I feel the student gets stuck is that it has got 6,000 questions. Okay, 5 to 6,000, and students are unable to complete it. Okay. Most of the students are working. Okay, they're working in the hospital 9 to 5, and they're able to give only 1 to 2 hours a day, because most of them at this point in career, they may be married and they may have other things to look into it apart from the professional career. Okay, so they are unable to give the time, and they apply for the exam thinking that they'll be able to prepare in 3 months or 4 months. Remember, past test is not going to finish in 3 to 4 months. Okay, it will take at least 6 to 8 months time. Okay, even if you get best shot, because reading once is not sufficient. Reading at least 2 or 3 times is required before you give the exam. Okay, so always plan your exam well. Don't be in a hurry to apply exam thinking that I'll prepare in 3 months, I'll prepare in 4 months. Okay, but among the questions and the answer, past test is the best for part 1, provided you use it carefully and useful and use it well. Okay.
All right. All right.
Mind telling me? I would like to ask you a question.
Yes, sir. Yes, sir. Please.
Yeah. You said it's going to be 200 questions, and the passing marks is 140, I guess, right? So
no.
yeah.
Yes, sir. Let me know your question. I'll answer after that.
Yeah.
Yes.
My question is, what's the marking scheme? Like, how much a question actually, each question carries the marks? I mean, yeah.
Yes, sir. So what is the thing is that we do not get particular mark for a particular question. Okay. So for MRCP part 1, there are 200 questions and you should get above 540. Okay, 540. Okay. And scoring is, I'm afraid, is not quite clear. Okay. So they equate it based on how many percentage of the marks you are going to, you are cleared. Okay. So how many percentage of the questions you have answered correctly to that of the difficulty level. Okay, so they're going to grade a difficulty level for particular paper. Okay, and then they're going to they're going to see how much of the correct answers you have, how much of the questions you have correctly answered. Based on that, they're going to get a score. Okay.
All right.
So it is
it's
not quite clear. It's not
it's
like
not
one question 4 marks, 2 question 8 marks. It's not like that.
Okay, so you're gonna get a sum of a marks even if you answer it wrong.
Yes. So if you answered wrong, for example, if you answer 10 questions wrong, so you'll be like your correct answer is 180 out of 200. Okay.
All right. Thank you.
Okay. Welcome.
I have a question, Doctor, please.
Yes, please. Yes.
Actually, I haven't heard the answer for the which source to which bank source. I mean, which question bank? You said
question.
Yeah.
Yeah. So online question banks, we have 3. One is Pass Test.
Okay.
Second is Pass Medicine.
Okay.
Third is BMJ.
All right.
Okay, BMJ on examination. These are the 3 online question banks which are available. Okay.
Okay.
You need to the number of questions are different in different question banks. Okay.
Okay.
So based on how much time you have, you can choose take a subscription of these question banks. Okay.
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 And which one you just recommended for the
Pass Test? Pass Test is the best.
Pass Test.
Pass Test is the best, but it has about 6,000 questions in it. Okay.
Okay.
So you should have that much time to read and revise.
All right. Thank you so much for your help.
Welcome.
Hello, Doctor. I just have one more question.
Yes, please. Yes, please.
I'm currently doing my MD microbiology in India.
Okay,
so for my MRCP part 1 exam, does it consist of like microbiology, immunology, virology questions, or it's like the general format of all the subjects are included in it?
Yeah, it's a general, this is the scheme for MRCP part 1. Yeah, so you'll be having...
It's included.
Yes, all the like cardiology, clinical, all the clinical specialties will be included along with the some of the molecular biology and immunology. So I think immunology will come under your because you're doing microbiology. You'll be good with the immunology, some of genetics, and some molecular biology. You may be knowing it well. Okay, but you need to focus on the rest of the specialties so that you'll be able to get a good score in the exam.
Thank you so much, Doctor. I just joined the meeting a little later, so I missed the
No problem. We'll be sharing the recorded version as well. And if you have any questions, you can always log into our website or the Facebook page and you can share your queries.
Thank you so much, Doctor. Thank you.
Welcome.
Sir, I have one question.
Yes, please.
Yeah. Sir, you just told you answered another, I think one of the doctor's questions just now. You told that if at all, you gave an example saying if at all you have answered 10 questions wrong, your score would be around 180 out of 200.
Yes.
So I mean, we did not understand.
No. I was telling him like he asked how many based on how many questions. So for how it is calculated, like you have 200 questions, so you got 150 right and 50 wrong. Okay. So they're going to mark you 150 by 200. That's the amount of question you got it right out of the total question. Okay. Into difficulty level, which is based on their own calculation. I'm not sure how they're going to calculate the difficulty level. I think that it will be like 1, 1.5 or 2 or something like that, that number. Okay.
Okay.
Okay, based on that, they're going to get a score. Okay.
All right.
Okay. So what you need to get, you need to get as many correct answers as possible out of 200. Okay.
Yes. Thank you, sir.
Welcome.